The Auditor-General provides assurance to Parliament on the accountability and performance of the Victorian public sector. The Auditor-General conducts financial audits and performance audits and reports on the results of these audits to Parliament. On the 18th of March 2015, the Auditor-General tabled his performance audit report, Managing Regulator Performance in the Health Portfolio. We might not always see them, but regulations, the rules government imposes on businesses and professionals, affect us all. Regulations cover driving licences to drinking water, builders to pharmacists, and aim to protect the community from the potential harm that results from business activities. This audit focuses on regulators in the health portfolio, and this slide provides an overview of our findings. While diligent in applying regulations on a day-to-day basis, we found the sample of regulators we looked at are not near the type of better practice where they can demonstrate that they are efficiently achieving the intended benefits of regulation. Given their size and resource base, they need help to do this, but agencies responsible for this supporting them, the Department of Health and Human Services, or DHHS, and the Department of Treasury and Finance, or DTF, have not done this effectively. There are significant performance weaknesses that need to be addressed, and the remaining slides provide some more detail around these findings. Regulation is a careful balancing act. Regulators need to understand what they are trying to achieve for the community and balance these impacts against the costs to government and the inevitable burden they impose on those that are regulated. The diversity of Victoria's 58 regulators further heightens the challenges in consistently raising regulator quality and effectiveness. Our audits over the past 5 years show some consistent and significant weaknesses. We highlight the absence of a risk-based approach. A risk-based framework, when properly applied, is a good way of prioritising the use of limited resources to achieve the intended outcomes of regulation, while taking account of the costs and burden imposed on businesses. Government's consistent policy over several years has aimed to improve outcomes and efficiency, while reducing the burden imposed on the business community. Of particular interest in this audit is the Stage 2 Statements of Expectations, or SOEs, which required all regulators to respond to ministers' expectations about how they would improve performance over a 2-year period. We focused on the health portfolio, and these pie charts show that health regulators, by many measures, such as staff and licensed parties, are extremely small players. But these are not the only measure of importance, because the things they regulate, for example, drugs and poisons, drinking water, radiation safety, food safety, and pharmacies, are areas where it is critical that the government and community are protected. For this audit, we decided to examine the health area, where our coverage has not been as extensive because of the smaller scale of the 14 regulators. We selected one statutory regulator, the Victorian Pharmacy Authority, or VPA, and 3 embedded regulators for detailed examination. We also examined the oversight and policy leadership and support roles of DHHS and DTF. We found that the sampled health regulators did a good day-to-day job, and we saw examples of good practice. For example, VPA and radiation safety are collaborating to manage the risks of drugs that contain radioactive material by developing and trialling a joint inspection protocol. And radiation safety is trialling a process for more effectively assessing and managing risks. However, the lack of a structured and comprehensive approach to risk management undermined performance, and you can see on the slide the areas of clear weakness. Health regulators need to address these weaknesses, but as small organisations they face challenges in achieving this, so DHHS and DTF need to support them. This slide shows how the health regulators performed against the requirements for an effective risk-based approach to regulation. You can see that in all but one category, most regulators did not meet these criteria. It has been clear from the early planning stage that DHHS has not effectively supported and overseen health regulators. We take as positive first steps that DHHS is recognising this need and changing its structure to more clearly focus attention on regulators. DHHS now has to follow through on its intentions by committing to the implementation of a strategy to effectively support and oversee its regulators. The way DTF implements whole-of-government policies to raise regulator performance needs to improve because DTF did not adequately advise the government on the risks to success of a truncated timeline for implementation and adopting the same approach to regulators with widely varying capabilities and resources. Once it issued the guidelines, support and review were reactive rather than proactively applied, and this was not sufficient for smaller, less mature regulators. And it has not adequately defined outcomes and how these would be measured. DTF needs to address these areas. The following 2 slides list our 5 recommendations. They are designed to improve health portfolio regulators' performance and the oversight of DHHS and DTF. Agencies have accepted all the recommendations. To recap, our key messages are that health regulators need to develop and implement plans to address clear weaknesses and gaps. DHHS needs to follow through on its intentions and implement a strategy to effectively oversee regulators. And DTF needs to improve its advice to government on the risks, be better prepared to measure performance, and provide tailored support and review to regulators. Our concluding statement is that regulators need to improve their performance by applying risk-based regulation, but need help to do this from the Portfolio Department and DTF. Our past relevant audits in this area include the audits listed on this slide. All our reports are available on our website. If you have any questions about this or other reports, or if you have anything else you would like to discuss with us, including ideas for future audit topics, please call us on 03 8601 7000 or contact us via our website.